Eagle News America. I'm Alan Basoyahe in Los Angeles. Tonight, we get to listen to a story of a mother, wife, and frontline healthcare worker who recently battled COVID-19 as a nurse and as a patient. But before we meet her, let's watch this.
Mary Tess Herrera, or Tess to her friends, is a wife and mother of 3 rapidly growing children. Religion is at the heart of Tess's household, and when the coronavirus pandemic struck, she, like many others, prayed for her family. She would pray for them before leaving them to answer the call of her other duty, to care for COVID-19 patients. Tess Herrera is a nurse.
It wasn't easy being apart from my husband and kids, but when you're a frontliner, you have an obligation to help.
Help, however, would come at a cost, one that Tess couldn't avoid paying.
I contracted coronavirus.
The widespread coronavirus had seized yet another victim, this despite precautions being taken.
My assignment was to care for 17 COVID patients, and so I followed every health protocol, washing my hands frequently, wearing PPEs, etc. I self-isolated at a hotel so that in case I get infected, the only person I'd have to worry about would be me. No one wants to think about getting sick, but when you're in the healthcare profession, the risk is always there, no matter how careful you try to be. I rested as much as I could, prayed every day, and kept my faith in God, trusting that He would take care of everything.
Today, Tess is back at work, continuing to brave the hazards of a world beset by COVID-19, relying on her strong convictions and the support of family to see her through. In Los Angeles, California, Eva Basayahe, Eagle News, we live in interesting times.
Mary Tess Herrera joins us on our broadcast today. Mary Tess, 2 questions before we get started. First of all, how are you feeling? And secondly, can I call you Tess?
I'm feeling fine, Alan, and yes, you may call me Tess. I'm more comfortable with that than Mary Tess. Nobody really calls me Mary Tess.
Okay. Well, Tess, listening to this report, I understand that you're married, husband's name is Paul, and you have 3 children, and I think they like to be called young adults, I believe is what they like to be called. How does your family feel knowing that your assignment takes you straight into the pandemic?
They're worried all the time. They ask me how I'm feeling. We have a routine every time, every day. It's a same exact routine. When I leave, they say, be careful, we'll see you later. When I come home, I'm greeted with a blanket so that I can take off all of my scrubs, and my shoes is left outside. And after that, I wrap myself with a blanket and I go straight to shower. That's every day, every work day. So it's hard.
Now, take us with you to the front line. What kind of havoc does coronavirus wreak over the lives of your patients?
Our facility, it's called a skilled nursing facility, and these are elderly patients that we have, and it's our main goal is to keep them healthy, keep them alive, living. It's their home. So for them to be touched by this horrible bug and seeing them get it weaker and weaker, it's hard. Our facility is not equipped like an emergency hospital where all the equipments are there to help them. But if they are positive and they're showing symptoms, the difference that you see in their demeanor and the way they are before getting sick, it's heartbreaking. You see them always every morning. Before they're always saying hi. Activities, they're looking forward to it. They know who their nurses are, so they're looking forward to meet them. But when they're sick and they look frail more than before and unresponsive sometimes, it's hard to see that. I'm not used to seeing my patients feeling sick and feeling weak. And that's what we had in our COVID. Some passed away, and others survived. And it comes and goes. We had about 2 cases already having to have a COVID unit. That was the earlier, and then the last case that we had was about maybe just 2 weeks ago.
And then the moment arrived when you yourself tested positive for COVID-19. And I do want to talk about your experience with the disease, but before that, I want to address the feeling of guilt, because you told me that you did feel guilty over getting sick.
Yes. The first thing when I was feeling the symptoms, because I stayed in a hotel right when I got assigned for the COVID unit. But 2 weeks into my assignment, pulling 12-hour shifts, 3 to 4 days, it takes a toll. And that one afternoon I came to the hotel, I felt the symptom. The first thing I could tell myself is like, why? What did I do? I did everything that I could, but I knew it. I knew I had it. The fever came first. And the guilt was that I'm a healthcare worker. I should know better. But I guess this bug is just too strong.
Sure. And Tess, I'm quite positive. I, for one, can also attest to this, that I'm sure nobody blames you for getting sick, that you did absolutely everything you could. But now let's talk about the sickness. Talk to us about the experiences, the symptoms that occurred.
As a nurse, we saw it happening. So that night when I came home, body aches started. And I was trying to psych myself up. I'm like, I'm going to take Tylenol. I'm just going to rest. I told my family, I told my DON already. I texted her right away and I said, this is not looking good, but I'll let you know tomorrow. And sure enough, the next day I had a fever. And the first thing that my DON texted back to me was, go get tested, and you're off for 14 days. So I was off the schedule, off the assignment, and went to Kaiser, drove myself. My husband wanted to come with me, but I said, there's no way. No matter how much I wanted him to come, but what I was feeling, I knew what it was. And then the very next day, Kaiser has a really quick response to all the testing, and I was positive.
Now, you mentioned, we heard, yes, and we heard in the video that you had to take measures, right, to protect your loved ones. Can you elaborate more what you actually did to protect your loved ones, your family members?
As soon as I had the assignment, my first protection, my first instinct was to go in a hotel. I'm grateful that our state provided that to all the healthcare workers. I wasn't gonna bring that home, and my husband was adamant about it. He said, "Oh, we'll do the routine that we were talking about," but seeing my patients and seeing how they were feeling, I didn't want to bring that home. It was just too scary. It was, my protection was the hotel. That's the first instinct that I did, and no contact at all with anybody. I even had meals delivered I didn't want to go out. I was afraid the guilt will set in more if I go out knowing I was positive. So I guess that's one of the perks. I get to have delivered food in my hotel. But yeah.
Right, and hopefully next time your hotel stay will be with your husband and family on vacation. Tess, thankfully you've made a recovery, a full recovery, right, by the looks of it. What do you attribute as the single most important factor for being able to bounce back and rejoin your family?
Just knowing how to be able to take care of myself. I provided that to my patients, so I was confident. But the 2 weeks that I had to recover, being sick and having recovery, the first thing that I was truly grateful for was the technology that we have. I was still able to worship. I was still able to perform my duties as LOS secretary and attend meetings, do FaceTimes with anybody I can do. It's really lonely in the hotel for not being able to come out and just having food delivered. It's not fun at all. But just the fact that even though I was feeling low and scared most of the time, really, I had the connection electronically, and especially with worship services and meetings, I was worried about that too as well. So I was able to connect all the time.
Right. Well, I know that eventually everyone would get tired of watching hotel cable, so I'm glad you're able to keep your spirits up in that manner. In our panel discussion tonight, we have our Eagle News correspondents who also have perhaps a question or two to direct in your direction, Tess. And we go first to Chai Masaga in Maryland. Chai, please join us. What do you want to ask our guest tonight?
Yes, Alan. First of all, hi, Tess, and thank you for sharing your story with us. And we're happy that you're okay and fully recovered from COVID-19. Well, I only have one question, Tess. You're welcome. The very first time you learned that you tested positive for COVID-19, what's the very first thing that crossed your mind?
The very first thing was I'm off the assignment. How is my patient's gonna be? How I'm gonna tell my family. The first person I told was my husband, and sure enough, he was going crazy out of his mind. I pretty much I had one point where I didn't want to tell my parents. They're at the state where I didn't want them to worry. So I kind of held off on that one. I think they were the last ones I told. I told my siblings, but I could tell them, no, tell mom and dad. I told my closest friends. But the first thing that came to my mind was, what did I do? And I tried all the things that I done to protect myself, but still yet I got it. So again, the guilt there too came in.
But still you recovered. Thank you, Tess.
And how about lovely Anderson from Fort Worth, Texas?
Hi, Martez. Thank goodness that you're well now. First and foremost, I want to thank you so much for everything that you're doing and all the efforts you're doing for your patients as a healthcare professional. However, a question that I have is, my biggest fear is being away from my family for so long. 2 weeks without your family. What kept you sane? What kept you going?
Actually, I was sick for 2 weeks, but I was in the hotel for about a month and a half. So what kept me sane? A lot of Netflix. Just kidding. No, I slept most of the time, to be honest with you, pulling 12-hour shifts when I'm scheduled to work. the first thing that you do is just see that bed and just plop down and sleep, and then you're like, oh no, I have to wake up the next morning. So the our ability to be able to connect technology wise is amazing. All my friends were calling me. I think, I don't want to be mean, I was getting annoyed at one point where I just want to sleep and everybody's calling me, especially my mom. So that's how I coped with it. Sleep, getting rest, and keeping yourself handy, keeping yourself with Netflix and all that technology can offer is the best.
And you know, Tess, we have also with a question our sometimes bureau chief from Las Vegas, sometimes beach goer in San Diego, Anna Kui.
Tess, thank you, and I'm glad you are well now. So I was wondering, if there was I know there's probably, nothing that you could prepare specifically, but was there something that you wish you had, while you were in isolation that you didn't have with you?
I'm sorry, can you repeat that? Is there something that I have?
Yeah, during, when you were in isolation, was there something that that you wish you had, that you didn't have with you, that maybe that could have helped you, maybe?
I wish I had my family. I'm used to coming home and trying to get on their case, like, what did you guys do all day long? I didn't have that. I came home to an empty room, and though tired, and yes, I fell asleep, but there'll be nights sometimes that I just twitch and it's just too quiet. It's like something's wrong. My husband laughs at me all the time because I have the TV on and I have all the lights on. I'm a scaredy cat, so I need white noise around me and the lights on. If not at home with him, I probably in the dark, probably I can sleep better. But being alone, my friends know I'm a scaredy cat, so
Yes.
yeah, definitely I would like to have my family there.
I'm with you there. Well, thank you, Tess, for sharing your story.
Now, Tess, we have two correspondents from North Hills, California, also in this panel discussion. We'll start off first with Mylene Cuscio. Mylene.
Hi, Tess. I'm glad you're feeling well. Thank you for all that you've been doing as a healthcare worker. I do have a question for you. I know that you love to eat. How did the COVID-19 affect your taste in food?
Okay. I love to eat. I love food as hell. I gained a lot of weight because of that. All my friends know, I hate spicy food. I hate with a passion. I don't understand how people can eat that. But having one of the symptoms of COVID is loss of taste and smell. I was really disappointed. I'm paying for all this money and I can't enjoy my food, even though I know it looks good. A juicy hamburger, a nice pasta, had no taste, had no smell. And I even made everybody laugh with this. I bought the spiciest food I could find, which is my favorite. It was the shrimp, stinking crab, like the those shrimp that it's in the bag with all the good stuff in there. I normally just buy it lemon, what is it called? Lemon garlic. So plain, but it tastes so good. But I bought it very spicy, and I actually enjoyed it.
Wow.
And that was surprising.
Yeah, let's.
But did I go back to?
All right, let's forget about getting
Did I
sick.
go back to eating spicy?
Yeah, Tess, let's forget about getting sick because we don't want to give up our love for food. We have time for one real quick question. Prorrogación in North Hills.
Hi, Tess. It's always a good news knowing that someone survived from this pandemic. So I have a question for you. When you fully recovered from this virus and you're ready to go back to work, were you really ready going back to work? How did you feel? Were you excited or were you scared that you might get it again?
There were two parts to that. Of course, all of our fellow nurses, we keep in contact with each other, especially with questions and how do you do this? How is so-and-so? How is this? Part of me, I was really saddened when I was gone for 2 weeks. Some of my patients passed away. So I wanted to go back. But honestly, I know it's the job. I know it's what I signed up for. To be honest, no. I'm just tired. And then having our facility being COVID-free, I was elated. I was like, yes, finally. So that one, so the emotions go from here to there. And then having it back again 2 weeks, I was surprised. And I was gearing myself up like, okay, here we go. 12-hour shifts, hotel again, hotel. So yeah, you just have to deal with it, I guess.
Well, Mary Tess, on behalf of all the 12-hour shifters like yourself, we do thank you so much. And that we actually come to the part of our broadcast where we continue to thank frontliners, first responders, and essential workers like Mary Tess Heredia with a round of applause. Let's give them a round of applause, everyone. We appreciate you. Thank you so much for joining us. And that is today's Eagle News America. Thanks for joining us. I'm Alan Basoyahe. We live in interesting times.